I got married when I was 17 and my daughter was born 18 months later. When I met Vara, the health mediator, she invited me to come and meet and speak with other women like me. We talked a lot about contraception and especially IUDs. Most of the women had only heard negative rumors and said their husbands didn't approve of contraception because they had heard bad things about it.
Roma communities in Eastern Europe experience unacceptably high levels of social exclusion and discrimination. Those living in greatest poverty and isolation are most vulnerable. Women and girls here face the greatest obstacles to living safe and free reproductive lives. Now, with support from inside and outside their communities, these Roma women, girls and young people are overcoming some of the barriers.
One day we discussed what we thought was a good family size. I thought more often about my family. It was a challenge to pay our bills and provide for our baby. My husband and I started to talk about it. 6 months ago, I decided to have an IUD fitted and I feel fine. My friends think I'm crazy because I only have one child. But I know that I'll be able to decide when to have another one.
If people have limited knowledge and poor quality information about modern contraceptive care, they are vulnerable to myths and disinformation. But when they are enabled to make informed choices, they can decide what is right for themselves and their families.
At one home visit, I was surprised that more than 10 women came to ask questions about their sexual and reproductive health. Many of them I recognized because they are my patients at the health center. They opened up and they were really excited to learn. One woman said her daughter had had a cesarean and skipped the medical exam afterwards. When I explained the risk, the daughter came for a checkup the next day. This kind of fieldwork teaches me that we doctors have to act in a more human way, to be more patient and take time to listen.
Women and girls need health professionals to provide high-quality, non-judgmental care without discrimination.
I started participating in sex education workshops with other young people 10 months ago. Thanks to the good atmosphere and open discussions, I now feel more comfortable to ask and speak to my father about sexuality, love, and how to protect myself.
I'm really happy to know I can step out of a more traditional picture frame.
When young people in Roma communities can build life skills through relationships and sexuality education with their peers, they are empowered to live safer and freer lives.
The kids were very excited to learn something new. You realize that for a young girl or boy of 11 or 12, questions like how to use a condom, can you have sex with a girl on her period, and is there a condom for girls, are taboo, and they have no one to talk to at home because these things are seen as shameful. We are trying to explain that these are normal questions and it's okay to talk about them.
Local nurses, teachers, health mediators, and community members are working together to empower the younger generation to look after themselves and others. paving the way for greater gender equality.
I'm the bridge between the Roma community and the health center. Thanks to the outreach activities we organized in the community, more young women are now seeking gynecological care and asking openly about family planning services. Seeing the changes and supporting the community like this really motivates me to continue the work.
Health mediators from Roma communities are crucial figures in supporting people to access sexual and reproductive health care, in spite of barriers such as cost, distance, and systematic discrimination. This work, led by IPPF members and partners in the Balkans, shows how family planning, maternal health care, and sexuality education have the potential to change and save lives. So much can be achieved when professionals, volunteers, and community members join forces. Now, we need political decision makers at all levels to join our fight against discrimination and exclusion. Their sustained commitment and investment are vital to strengthening women's sexual and reproductive freedom and health.